Good assessment is one of the most important skills to develop in learning to most effectively support bereaved people. When you meet a newly bereaved person, or a person who's been bereaved for a long time, or when you begin discussing with him or her how you might be able to help, it's extremely important that you get as full a picture as possible of what's currently going on and how the bereavement is being experienced by this individual. Grief is idiosyncratic. In other words, it's highly determined by my own experience with the person who died. And therefore, how I apprise that experience, how I work through it, what kinds of things complicate that for me, are highly personal and individual. So, therefore, a thorough and ongoing assessment throughout the period that I support or counsel with an individual is extraordinarily important. Now, I've developed a tool that I call the Consolidated Bereavement Assessment, which is really just a big fancy name that puts in one place a place for me to indicate, to note specific things, and also to keep me on track, to make sure that I'm asking the pertinent questions that help me understand the breadth of the bereaved person's experience with this loss. If you've not already downloaded a copy of that form from our website at www.griefconnect.com, you should go ahead and do so that you have the sheet in front of you to look at while you're watching this video. Now, the Consolidated Bereavement Assessment is really a tool that I use simply in trying to help myself understand more fully what it is that this bereaved individual is facing, how he or she is coping, and the breadth of resources that he or she may have available to them. You'll notice that the sheet is divided into several sections, and I'll just kind of work through those one at a time. First, and maybe this goes without even saying, but the first thing that I want to know is how the person sitting in front of me is related to the individual who died. Now, I don't mean just relationship that he is a mother or father or sister or brother or husband or wife, but I mean, what was the relationship and what was it like? And so I may even be asking this individual a little bit about the relationship and inviting them to share a story or two about how that relationship may have unfolded, high points, low points, those kinds of things. I also want to understand something of the loss itself. How did this individual die? Was it expected or unexpected? Was the cause of death by some violent means, a car crash, a suicide, a homicide, or was it something different than that? And often I can see in the bereaved individual's face something of their own anxiety, a bit of their own distress about that. Obviously, knowing that information helps me also to assess for trauma, for the indication that there might be trauma present in the loss that he or she is experiencing. I'll talk about that more in just a few minutes. From there, I want to know a little bit more about some of the other loss histories, losses in this individual's history. How have they experienced losses before? And that can be a really important piece. What I find is that sometimes the individual death, the individual loss that brought this person to my office really was just the proverbial straw that broke the camel's back. But in fact, there have been many losses, perhaps losses that were not death-related, the loss of a job, the loss of self-esteem, the loss of mobility, the loss of an ability to do something, or the loss of valued possessions, perhaps foreclosure of a home or something like that. It might be that the loss that brought them here is really not even the most significant one they're facing today, but it is significant because that's what got them to dial the phone and set an appointment or to seek out help. Nevertheless, understanding a bit of where this person sitting with me has been in their own history of loss can be very helpful in understanding how best to support them. It'll probably be in that context that I'll ask a bit about how he or she feels they've coped in the past. How was that? How has that been? What parts of that seem unfinished or not completed for you at this point? Might be some of the ways that I would ask those questions. Then I want to know something about the breadth of experience that this individual is having with this particular loss. And I tend to assess that, though not in any particular order, but what I do try to do is make sure that I have, during this initial interview, learned something about each of the 6 areas that are indicated by those blocks in the form that you have now downloaded to use along with watching this video. In other words, I want to know something about the physical ways that he or she is experiencing grief. I'm going to ask about of this individual, or if I happen to be interviewing a parent about a child that he or she's concerned about, I want to ask something about how this individual's eating and sleeping. Are there nightmares that are awakening them? Is he or she having pleasant dreams, and so they awaken from a dream maybe comforted? They're having the experience of seeing the deceased person in their dreams, and is that a comforting image or a distressing image? And learning something about how this individual is experiencing grief physically, how they're eating, how they're sleeping, and how their exercise may have changed. I want to know something about that because it gives me some idea, first of all, is if this is simply bereavement or perhaps has become much more of a serious clinical depression nature. It also helps me simply to have a feel for how this person is coping and what changes he or she has seen physically. I also want to know early in my interaction with a bereaved person whether or not he or she's had a thorough physical examination. And I'm probably also going to ask a bit about medications that are being taken. And I have a couple of reasons for wanting to know that last bit of information. One is that if they begin listing for me drugs that I recognize to be psychotropic, or they're given for mental health issues, antidepressant or anti-anxiety medications or something of that nature, it helps me to get a feel in advance, frankly, before I ask even about counseling history. It gives me a feel for what might be going on in terms of the psychiatric history, which can be a very, very important piece. The other thing I want to know, though, is if they're taking other medications and how closely those are being supervised by a medical doctor. And part of my concern there is that certainly many of the cardiac or antihypertensives, the blood pressure medications and things like that, decongestants, prescription strength decongestants or antihistamines can greatly affect one's emotional state. And so it helps simply if I know a little bit about what's going on. It gives me some backstory, some history, some a little better understanding maybe of what's to be expected in this individual's physical manifestations of grief versus what might be distressing or of concern to me as the clinician. I also want to know in this interview not only how the bereaved person is doing physically, but I'm interested in knowing how he or she is doing cognitively. Or if I'm talking to a student or about a student, perhaps how he or she is doing academically. Cognitive kinds of things are also common in bereavement, but often are greatly misunderstood. I want to know something about how this individual is remembering significant events and dates. Not so much testing their memory as if I were assessing for dementia or something like that, but rather is this bereaved individual distressed by forgetting things, by not remembering where he or she put things, or by starting tasks and not being able to complete them because he gets distracted very easily. And a part of that, even though I'm interested primarily to know for support reasons. I want to know how the other people who work with or come alongside or interact with this bereaved person in the context of his cognitive awareness. I want to know something about what they apprise to be going on. Is this individual's spouse complaining about forgetfulness, for example, or school teachers noting the fact that the student seems to be distracted, not paying attention, not getting assignments turned in on time, and some of those kinds of things. Again, what we're assessing for, whether physically, cognitively, or in any of these other dimensions, is not so much just how things are presently, but how they've changed since this bereavement occurred.